Hello and welcome to my video. My name is Leslie, and this is actually a little bit of a test video. I have wanted to do a series where I break down employee benefits in ways that are easier for employees to understand. So I'm going to call this one Benefits 101. And our question for the day is I have health insurance through my employer. What should I expect to happen when I go to a doctor's appointment? Okay, the very first thing you're going to want to do is look at your insurance ID card. You usually need this when you go to the doctor's office. Even if they have it on file, they will like to scan it at least annually. Now, this card is either going to be physical or digital. And then printed on the card, besides your personal information and your group number and your employee ID number, is going to be a copay amount that you are expected to pay at the time of the visit. Now, you might see different copay amounts because one is typically for a primary care doctor and another is for a specialist. So you'll see $2 amounts. Now, if you don't see $2 amounts, that's okay. Don't worry because every plan is a little different. And mentioning plans that are different, I'm actually referring to what I would consider more of a traditional health insurance plan. If you have something like a high deductible health plan, your benefits and your plan is actually a little bit different. So I'm going to be recording a video on high deductible health plans. So the rest of this may not quite apply to you. But if you have a traditional insurance plan, keep watching. Okay, when you're going to the doctor, the first thing I want to think about is why are you going? Are you sick? And when I say sick, I mean like maybe an acute illness. You woke up, you have a fever and a sore throat. Someone else in your family has had strep throat, and you think, I might have strep. Or are you following up on a condition you already have? Maybe you take medication for something and you need to go back 6 months later or a year later to make sure everything is working. In those situations, you will be paying a copay when you arrive at the office. This dollar amount is usually collected whenever you register. And the way this works is you pay a portion for this visit, which is your copay, and your insurance company will pay the balance. So it's the difference between the total cost of the visit and your copay amount. Now, one tip that I want to tell you is your copay may only cover the office visit. So if you have something extra done in the office, like being swabbed for that strep throat test, or if you need to get some blood work done, those could be additional charges that are not included as an office visit. When you think of an office visit, think of the time you spend with the doctor. Anything outside of that may cost you additional, but you will be billed for that. You will not be expected to pay the day of your appointment. And if you're not sure about this, you can go see your plan for details. There's called a summary plan description, and it should outline everything in there. And your HR department can get you a copy of that if you don't already have it. Now, the other reason you go to the doctor is perhaps you're healthy, and this is just a well visit or an annual exam, maybe something you need to do for your insurance or just a good habit to get into, going to see the doctor once a year, making sure that everything is looking well. In this case, you will not pay a copay. So you'll show up at the office, and if they say, oh, hey, you have a copay today, all you need to do is ask them, can you double check that for me? Because this is a preventive care visit. And sometimes registration is just in the process of collecting copays, getting you registered, and they just might not know the reason why you're there for your visit. And in this situation of a well visit, your insurance company is going to pay 100% of the cost for your office visit, and you will pay nothing. Okay, I have 4 helpful hints for you to wrap things up. First thing, make sure you go to a doctor in your network if your plan recommends that you do that. You tend to get a lot more value for that, and your dollar stretches a lot further. Secondly, whenever you receive an explanation of benefits from your insurance company, you want to make sure you compare that with any bill you receive from your doctor. Now, if the term explanation of benefits has you confused, I'm also going to be recording another video breaking that down for you. And my third tip is call customer service if you have any questions. And customer service is the customer service department for your health insurance company. Their phone number is going to be on your ID card. They have access to all of your claims, all of your plan information, and they're going to be able to help you with any questions you have. Typically, they are a better resource for you than your HR department because they can see a lot more of your information than what HR can. And finally, helpful hint number 4 is to request a copy of your summary plan description if you don't already have one. This just lays out everything that you can expect when using all of your insurance. And sometimes we don't know what we don't know. So if you have this document on hand, you can highlight it, refer to it as things are going on along your healthcare journey. Okay, if this video was helpful, I know, like I said, this is kind of a test video. Want to make sure that it's serving you, answering questions that you have. I would ask that either you leave me a comment or give me a thumbs up on the video. If you would like to stay connected, you can subscribe to my YouTube channel where I'm going to be building this out a little bit. You can follow Carver Connections on LinkedIn, Facebook, and Instagram. And if you would like to connect with me personally, you can find me on LinkedIn under Leslie Carver. So I want to thank you so much for your time. I hope this was of value for you. If you have questions you would like answered, please shoot me a message and I will try to include that on a future video too. So thank you for watching and have a great day.